So we're going to welcome everyone to today's webinar. It's just 11 o'clock right now and people are rapidly coming into our webinar room. We will get started in really just a moment here. We're grateful for all of you joining us today and stand by for the start of our webinar. See a lot of our registrants joining us, logging in right now. And today we're going to be talking about the state of workplace mental health. And we'll get started in just a moment. So welcome everyone. I am David Shapiro, Program Manager for HealthLinks, a signature program of the Center for Health, Work, and Environment at the Colorado School of Public Health. And we're excited to have you joining us here today. We've had over 1,000 people register for the webinar and hundreds of participants joining us right now. So we're excited to introduce our presenter and panelists. And mental health has been obviously top of mind for everyone since the start of the pandemic. So, obviously this is something now that, is top of mind as we return to work and in this next phase of COVID as well. Few housekeeping items. I'm joined today by my colleague, Courtney Cuff, who will be managing in the chat room any type of technical questions you have. So if things come up, if you need any technical support or assistance, feel free to put that in the chat. We will have a few polls to keep you engaged during the presentation. And we will also use the Q&A for our presenter and our panelists towards the bottom half of the hour as well. All of you on the webinar are in mute. And you will be throughout the duration of the presentation. As I mentioned, please use the chat function if you have any technical issues today, and use the Q&A box for questions as they come up. And you can post your questions at any time during the presentation. We also encourage any questions that come up in the Q&A section for you to rate them, to give them a thumbs up if you want to move them up the scale in terms of how we ask them of our presenters when it's the Q&A. We are recording today's webinar and we'll share the link with you for distribution to your colleagues to circle back to the information that was shared. And so if you missed anything or need a refresher, the webinar recording will be available for everyone that registered as well as all of you participating today. And I'll mention this again at the end, but there will be a survey that you'll be automatically linked to at the end of the webinar. Being a center of excellence for total worker health at the Colorado School of Public Health, our center really appreciates any feedback you have about this. We collect your feedback and we make alterations and changes on future webinars. We take suggestions for topics and just in general, really appreciate you taking the time to fill out the survey. I will mention for those of you who are looking for continuing education credits, especially CHES credits. I know there are many of you on today's webinar that are excited to get CHES credits for today's participation. We do need you to fill out the survey at the end and include your CHES ID number. There is no longer a quiz required for this group. It's just filling out the survey at the end of the webinar. So thank you again for taking the time to do that. It really just takes a few moments. So here's what we're going to talk about today. We're joined by my colleague, Taylor Adams at Mental Health America. I'll introduce her shortly, and she's going to talk to us about the findings of a report that Mental Health America recently published called Mind the Workplace, about the state of our workplace mental health collectively over the course of 2020, which really was a challenging year. And so a lot of new stressful events came up, and we'll hear from this report about 5,000 employees across the country were surveyed across 17 industries. And we'll get to hear a little bit of the findings from that report as well. After that, we'll have a panel discussion with our panelists, including a Q&A, where all of you can put your questions in the Q&A box and ask us, ask the panelists, myself or Taylor, any questions that come up. And then we're excited today to let you know that we're launching a module for HealthLinks, which is the workplace mental health module. And we'll talk more about that at the end of the presentation as well. So HealthLinks is a certification program, a recognition program on total worker health, where we recognize, advise, and certify organizations to be healthy and safe workplaces. And we've been in existence since 2013. We've recognized over 800 employers. And today, in a celebration of Mental Health Awareness Month, we are launching a specific survey and assessment tool on workplace mental health that all of you will have access to. So I'd like to introduce our keynote presenter, Taylor Adams. Taylor is Mental Health America's Director of Workplace Mental Health, and she spearheads Mental Health America's efforts on its Bell Seal for Workplace Mental Health, the National Employer Certification Program, as well as its annual Mind the Workplace report, which is what we're going to hear about today. Taylor's previous work was focused on suicide prevention, and she brings her experience to support companies on evaluating and refining policies to support staff in their mental health journeys. So I'm going to turn things over to Taylor. Taylor, thanks so much for joining us today.
Yeah, thank you so much, David. So let me pull up a couple slides here that I'd like to share with you. Okay. Does that look good? Look good on your end here?
Looks great.
Okay, great. Sorry, I will get started just a moment here. Okay, great. All right, well, thank you so much, David. I really appreciate you asking me to participate in this and share some of our findings over the last year with the pandemic and the impact that it's had on employee mental health, wellness, and basically everybody's been touched in one way or another. Just to give you an idea of who we are, Mental Health America is the nation's leading community-based advocacy organization dedicated to addressing the needs of those living with mental illness, but also just promoting overall mental wellness. We're guided by a before stage 4 philosophy. So, it's really important that we treat the signs and symptoms of a mental illness long before it reaches a point of crisis, just like you would with any physical illness. So all of our work in public education and public policy and our workplace initiatives have that prevention, early intervention lens to the work that we do. I want to talk a little bit about a program we have, because it kind of sets the stage for some of the trends we've been seeing over the last year. But we do have a MHAscreening.org online screening program. So there are 10 scientifically validated mental health screenings on this website. Free, anonymous, and confidential. You can see that the number of screens that we have here: depression, anxiety, bipolar. And this is just for anyone who's exhibiting signs of a mental illness, but they're not necessarily ready to go to a mental health professional or a provider for a diagnosis. They're just trying to gather more information and figure out what type of supports exist for these conditions. And this is a really great program because we do collect optional demographic information on the people who take the screen. So there's no way to identify the person who takes the screen, so that it does remain anonymous and confidential. But we do ask optional questions about gender, race and ethnicity, age, income. Are you part of a special population such as veteran, new and expecting mother? Are you a trauma survivor? because we really want to understand, the people who are coming to take a screen, which has been up to 10 million folks since 2015, and understand what their needs are and what type of supports that they're looking for. So in the last year, since 2020, it's been a bit of a doozy. We've seen a dramatic increase in at-risk or moderate to severe results for depression and anxiety and even psychosis. We've seen increases across the board, but these were some of the most dramatic increases in numbers of people who are coming to the site and screening, positive for having a mental health condition. I think it was 800% increase in depression screenings, and this was taken in September 2020 compared to January of 2020 before the pandemic, and then a 600% increase in our anxiety screenings during that same time. So this is millions of people coming to this site, and either they have been dealing with mental health conditions before the pandemic, or they're experiencing signs for the first time, and they're turning to this to get answers. So I really want to hear from you. So we're going to pull up a poll, and I think it's just a yes or no poll, but if you want to drop some information in the chat, you're more than welcome. But has the pandemic negatively affected your mental health personally? I know, that as people who are in charge of other people, if we manage other people as an organization, we've thought a lot about how to take care of our employees. But on the flip side, we got to make sure we're taking care of ourselves as well. So I just will take a couple minutes and just, has it affected your mental health? And what are some of the things that have been most challenging for you? If you feel like sharing that in the chat, please feel free to do so. All right, okay, that's not surprising. 73% of folks say that their mental health has been impacted by the pandemic, and this very closely reflects some of the findings that I'll share with you in a second here. Great. So David mentioned this Mind the Workplace 2021 report. This is a report that we put out every year, but this report was, really unique in that we had an opportunity to look at how the pandemic has been directly impacting employee mental health. So I mentioned that MHA screening and some of the increases that we saw there. As part of that program, we also include the work health survey, which is used for our purposes in gathering information and research to create this report. And we know it's really important that we look at, what's the general landscape, and not just people dealing with mental health conditions, but how is this impacting everyone who could benefit from having that psychologically safe workplace, and, just want to feel emotionally supported, regardless of having a diagnosed mental health condition or not, right? And I'm not going to tell you the business, laid out why it's so important, because I think we've had a crash course in the importance of mental health in the workplace in this last year just by living it. But we know that employers and employees receive a host of benefits from a workplace that supports mental health, considers that as part of their strategy. Employees are happier, more productive, more loyal to their organization. And then employers, retain talented employees and just improve overall business operations. So getting back to the report, we wanted to understand some of the specific challenges that employees were facing, and this was across 17 different industries in the US. Over 5,000 employees took this survey, and it was over a 9-month period in 2020. So right around the time that the pandemic had hit through October. Some of the things that we looked at specifically were workplace stress, burnout, financial insecurity, and also just manager communication styles, because a lot of people, almost everyone experienced a change in their work environment, right? Like whether that was switching to a hybrid work model, working remotely, there was increased work hours or decreased work hours or workload for being a frontline worker. Everyone had some type of shift in their routine and their environment. And we saw that 9 in 10 employees reported that their workplace stress was affecting their mental health. So this wasn't directly related to the pandemic, but whatever they were experiencing at work and everything that the pandemic had brought in terms of change was affecting their mental health. And we saw that talking to a manager or supervisor about changing stressful things about your work was most strongly correlated with the healthiest overall workplace scores. So people who are able to talk to a supervisor and just tell them that, yeah, this is particularly stressful for me and I'm not able to, meet certain expectations because of this, were in places that were healthier than others and didn't feel comfortable sharing that with their manager. And then we also saw that 3 in 5 employees are not receiving support from supervisors to help manage their stress. And when we talk about support, we did ask specifically about emotional support, which, there's just been this idea that when you come to work, all your personal issues, all your stress gets left at the door, and then you come into work and you're a professional. That's just not how stress and emotions or people work. You're likely bringing in stress not only from your personal life, but also from work, and this is going to be affecting your performance, and you're going to be looking for some type of support to help you get through that and meet those expectations. So we'll talk a little bit more about that in a couple seconds. But I wanted to turn to employee burnout. This was defined by the World Health Organization a couple of years back, and we're just trying to get a sense of what this really means and what this looks like. This isn't surprising because I personally felt this in the past year, and I'm sure a lot of you have as well. But 4 in 5 employees felt emotionally drained from their work. And emotional, mental, and physical exhaustion is an early sign of burnout. That's one of the earliest signs of burnout and one of the easiest to treat. Not easy, but easier than some of the other signs of burnout, in that this is the point where you would take breaks from your work throughout the day, using your PTO to take a vacation, taking time off of work. And we noticed that people were not taking time off of work because we aren't really going on vacations in the traditional sense. And it feels like you don't want to waste that valuable time if you're not going somewhere. And so people just aren't taking that time off, and it's having effect on just the energy that they can dedicate to their work. We also saw that, and I think this is pretty significant, but 25% of employees reported that they're experiencing the more severe signs of burnout. So this is reduced professional efficacy is one of those signs, as well as feeling more cynical towards your coworkers, towards your supervisor, towards your job in general, towards your clients. I've noticed this with my own coworkers, where our culture is traditionally very supportive and emotionally supportive, and I really enjoy the people that I work with. But everyone is so tired and so feeling very cynical. They're getting very irritable when interacting with other people, and that's just not in their personality. But we're hitting those walls, and we're hitting those signs of burnout that are a lot more difficult to alleviate once it gets to that point. Which just kind of leads me into my final point here, that sometimes it requires a change in project, a change in manager, a change in teams, a change in job to help alleviate some of those more severe signs of burnout. And we did see an increase where 56% of employees report that they spend time looking for a new position. And this is compared to 40% in 2018 when we asked the same question. So more people are looking for different positions because it's just they're feeling those signs of burnout, and there isn't a whole lot of relief for that. But we'll talk about solutions. I realize all this sounds really negative, and I don't want to be like everything is terrible, because I'm excited to hear our panelists and hear about some of the solutions to these issues. I'm going to cover this one last item here and then move into the poll. But I want to talk a little bit more about environment. So, regardless, everyone's situation has changed. So regardless of the situation, everyone's had some type of added distraction to their work. If that's working in the same home with spouses, partners, family, children, pets, I'm like praying that my dog doesn't, get up and tell me that he has to go for a walk right now. because that's time and I'm here, so that means all the time for him, right? So everyone is feeling some distraction from just sitting down and be able to work. It could just be not having a designated workspace. It could be feeling having feelings of isolation and not being in an office, feeling unsafe physically and feeling like you could get sick if you're a frontline worker and you're interacting with the public on a daily basis. So 65% of employees that they found it difficult to concentrate because of their work environment. And again, this is compared to 46% of employees in 2018. And then one of the final things I wanted to share with you, because I mentioned, it's not just about people who live with mental health conditions and have been and are in the workforce, but anybody who has mental health and deals with stress and has the potential to deal with burnout. Any of these issues if left untreated or go unnoticed could lead to larger mental health concerns. But we found that less than 5% of employees strongly agreed that their employer provides a safe and supportive environment for employees who live with mental illness. As someone who is a person with lived experience with depression and anxiety, this isn't surprising to me. But for a lot of people, that's not great news. And that's why we're seeing, these issues aren't new. These are kind of, things that just came to light in the last year, but they've always been issues. We've always been dealing with stress and burnout and, maybe poor management or just benefits that aren't suited to what employees' needs are. And the pandemic's really been an opportunity to see what some of those gaps are, which in a way is a bit of a silver lining. But I am going to move to our next poll question here. Same thing, you can drop your thoughts in the chat there. I'd love to see them. I'd love to hear it. But has your organization offered new, this could be benefits, programs, perks to support employee mental health in the last year? So yes, no, not sure, but please feel free to drop things in the chat there if we'd love to hear from that. We'll just give that a couple seconds there. I know before I hopped on, okay, great. So we have 52% said yes, 36% said no, 12% said don't know, which if you're not aware of the benefits offered, there wasn't a good job in communicating that. Okay, that's interesting. So I'm gonna look at that as 50-50. Yeah, so I'm just gonna skip over this last part here in the interest of time. I did just want to share my contact information because I spoke fast. I tried to cover a lot. So if you do have questions, please feel to reach out, and I'll turn it back to you, David. Thank you.
Thanks, Taylor. Thanks so much for sharing the results. And one question did come up, Taylor, if you don't mind, we'll address it now. A list of the industries the job fields that were in the survey, is that available? Or we can certainly share the full report with people. Was there a prevailing industries or sectors that responded more frequently to the survey? Yeah, so yeah, all the industry breakdown is in the report itself. So do encourage you to download that if you're really interested in the breakdown in that way. We saw that it was interesting. So food and beverage, retail, manufacturing were our worst, like our unhealthiest industries, and that came up a lot. And then financial services, healthcare, and nonprofit actually did the best in terms of healthy scoring, which there's some controversy there because we know our healthcare system has been overworked and taxed for the last year. But in terms of support and benefits, have been getting the support that they need more so than other industries. But yeah, you can find the full breakdown of that in the report itself. And we'll share the Mind the Workplace report with all of you as a follow-up to today's webinar as well. So circling back, we're going to switch over now to introduce our panelists. I'm going to introduce all three of our panelists, and then we'll hear from each one of them in order that you see them sort of from left to right here on the screen. So first, we have Dr. Andrea Holman. Andrea serves as Associate Professor of Psychology at Houston Tillotson University, where she was recently hailed as Faculty of the Year for the 2019-2020 academic year. She primarily engages students in the classroom and conducts research understanding the psychological experience of African Americans. She also serves as a consultant for organizations who desire to enhance diversity, equity, inclusion, and belonging practices. Andrea's authored articles on issues of race in publications such as The Counseling Psychologist and Harvard Business Review. Thank you, Andrea, for joining us today. We also have Nick Williams. Nick is the Director of Operations at Absolute Caulking and Waterproofing, Inc., a HealthLink certified organization. And he served for 6 years as the chair of American Subcontractors Association of Colorado, their Health and Safety Committee, and is current board president. Nick's a graduate of CU Boulder with 2 bachelor's degrees in literature and philosophy, and he spends most of his free time with family and friends in nature, playing trivia, and aggressively consuming all things pop culture. Thanks, Nick, for joining us as well. And third, we have Sean Sullivan, Partner and National Abilities in Motion Chair at KPMG. Sean's the National Industry Leader for KPMG's telecommunications practice. He's actively involved with several corporate citizenship initiatives at KPMG, including being the partner in charge of the Denver office Abilities in Motion Business Resource Group, which has focuses on mental health initiatives. Sean has served as the chairman of the diversity committee for KPMG's market development organization, and he also co-leads an effort within the firm to recruit and retain employees on the autism spectrum. Thanks as well, Sean, for joining us today. So we're going to start with Andrea, with Dr. Holman, and we really want to better understand mental health from the standpoint of people of color and what that looks like in the workplace. And so Andrea's done research on this, and Andrea, if you don't mind, telling us a little bit about what the mental health experience may look like, and what we should consider when talking about the BIPOC community when it comes to workplace mental health.
Sure, yeah, I'd love to. If I can do that in just a few minutes, since we don't have the half a day that I could devote to it. I think first and foremost, it's important to just humanize the BIPOC experience and not compartmentalize it. So there's full humanity there. So everything we've been talking about is experienced by people without racial privilege, right? And so the depression, the anxiety, the illness anxiety, all of those things are experienced. But what can be not necessarily guaranteed, but what's likely also happening is the incidence of race-related stress. The last year alone has shown quite an increase in attention paid to and focus on things like police brutality, racial injustice, and those things. And that's stressful. There's a whole construct around that in psychology. So that thing also is not compartmentalized. So that bleeds into other areas of life. Just like Taylor said very well, the personal and the professional are not just explicitly demarcated. There's overlap there. So when you have things going on in your personal world where people in the chat have talked about things like parenting and childcare and how that can be stressful. If you add to that, let's say, for example, the Black American experience, where you've got parents who then are concerned about their children leaving the home or their spouses leaving the home and what will happen to them, their physical safety. Stress is stress is stress, right? So it's going to impact the body the same way, whether it's race related or illness related, pandemic related or whatnot. So I think it's very important to consider that there could be an added layer of stress that's unique to those individuals that they're struggling to manage, in addition to all of the other things that's just life, right? Especially how life has looked in 2020.
Thanks so much, Andrea. Really, important for us to acknowledge and understand that as well. We're going to shift over to Nick. Nick, you're our representative from a small business here on the panel. Would love to hear from you a little bit about your company, who you represent, and also why mental health matters to Absolute Caulking and Waterproofing.
Yeah, Absolute is a new commercial subcontractor. We work mostly in the Front Range area on new commercial work. We are, like you said, we're a small business, we're family owned. It's been very important since I first got involved with the organization 13 years ago to establish new and better safety protocols. About 7 or 8 years ago, that started to include mental health and health in general, holistic health. And so it became a real passion of mine, not just at Absolute, but at the American Subcontractors Association of Colorado, to attempt to lift the conversation up and make it a part of what we do in our daily construction lives, to really care a lot about the mental health of our employees at Absolute and at the subcontractor community in general. A lot of you might not know this, or some of you might, but suicide and mental health are very prevalent in construction. It's actually one of the leading causes of death in construction workers is suicide, and alcoholism is part and parcel to a lot of that. So there's a lot of addiction and things like that that we need to deal with. And normalizing those conversations has become very important, especially throughout the pandemic, making sure that we're taking care of each other, working together to support each other, and making sure that leadership is giving clear, concise direction and also supporting people with resources.
Thanks so much, Nick. I want to remind everyone participating that if you have specific questions for our panelists, and I will address some questions as well, to put them in the Q&A section, questions specific to how to address and support the mental health needs of people of color, how a small business might go about making adaptations or changes or supporting the mental health needs of their employees. And now we're going to hear from Sean, who's representing a large employer, a larger organization. Sean, we'd love to hear from you a little bit more about who KPMG is and why mental health matters to your company.
Yeah, David, thanks for having me today. I'm pleased to present to you all. KPMG is one of the big four, if you will, accounting, tax, and advisory firms in the country and world, for that matter. We've got 220,000 professionals around the world, about 34,000 here in the US. So it's a fairly large organization. The importance of mental health for us at KPMG is really stems from the fact that at the core of our business is our people. Without them, we don't have a business. We don't make a product. So our people are our product. If our people aren't able to bring their whole healthy selves to a job every day, we're really unable to deliver the services at the high standard that our clients expect and demand of us. Our business requires that we work in a very fast-paced, deadline-driven, rapidly changing environment, oftentimes with significant financial stakes on the table for our clients. So all these factors are a perfect recipe for high stress that can lead to anxiety, depression, other forms of mental health problems if not mitigated and addressed. So KPMG takes this topic very seriously and has been focused on it for quite a few years now. Like most complex challenges, such as mental health, there isn't really a cookie cutter approach or a template that prescribes exactly how to do it, certainly for business people. We've been learning by trial and error, I'll be honest, getting smarter on what works and what doesn't. And with the input of professionals, our people, our clients, we're implementing things we know work and that data suggests will work. So it's a learning process, and we're constantly getting smarter. We're constantly adapting our programs and how we approach this topic with our people.
Thanks so much, Sean. I appreciate that. I'll respond to one question that has already come up in the Q&A. We do share the presentation slides that Taylor shared with us. So the slide deck will be available and shared with you post-webinar, as well as the full Mind the Workplace report you'll have access to as well. So you will get that data and the results from that survey. I'm going to start with a question, Andrea, that came up for you in Q&A, which I think a lot of these questions for all of our panelists to start to shift into is the how. How are we supposed to take care of employee mental health? And so for Andrea, a question came up of if an employer is working to be more inclusive overall with their total worker health or their health and safety programs, what are some things you wish we all should know that could help us be more inclusive of the minority experience when it comes to total worker health or workplace health and safety?
Sure. So really great question. I think what comes to mind for me first is awareness. Whether or not, I don't know where everybody's employers are in terms of education, knowledge, awareness of those things, but I think increasing awareness for all individuals at the workplace just around unique aspects of the BIPOC experience. So what race-related stress is, what race-based trauma could look like. I know that I've given lots of presentations, workshops, where people of color themselves weren't actually aware of what it is that they were experiencing. So they were saying things like, you know, after I watched the video of George Floyd's death, I can't concentrate, I can't get my work done. I find myself crying a lot, I can't focus. I'm like, yeah, that sounds like depression. That's secondary trauma is what that is, you know. And so people not even having the awareness that what they're going through actually is emotional distress, I think is a first piece of it. Just in general, but then to further that with the inclusivity to say, hey, this distress may not look the same in everybody. It may manifest differently just because you're being able to get up and leave your bed or your home or function, get your work done, doesn't mean that there's not distress happening. So I think including just a myriad of manifestations of that. And then further and beyond awareness of what those specific things that could be impacting the people of color in your office. Not necessarily assuming that they are, right? Because the BIPOC experience is not monolithic. What may impact one person may not impact the other person in the same way. So not necessarily trying to generalize to everyone, but keeping an eye on awareness and choosing to be aware of what you don't have to be. I think that's one of the essence of racial privilege. Is that you don't have to think about what you don't have to think about, right? And so if the people with the privilege in those positions of influence can choose to increase awareness, I think that's the first step to inclusivity. As well as I would add this too, checking in with your employees about what it is that they need, as opposed to assuming, because I think that's where you move from getting yourself seen as a racial advocate and ally and support to actually being one and having meaning and impact there.
Thanks so much, Andrea. You know, clear and consistent communication and being open to talk about things is definitely a really important first step in this, and we really appreciate your perspective. I'm going to shift to a question. I'll start, Sean, with you on this one, but Nick, I'm going to ask you this question also, which is, we know that employer buy-in is really crucial to have a successful mental health program and to raise awareness and to reduce stigma around mental health. I think beyond, for me, the question is how to improve employer buy-in. For me, that question is like, how do you get leaders, top leaders at an organization to have buy-in? Because I have a feeling most of us that are employees want these supports. But what does KPMG, and I'll ask you also after this, Nick, for Absolute, do to really engage leadership, top leadership, to make this an important issue?
Yeah, so I think for KPMG, you know, at the core of what we do and how we think about our employees and our work is our value set. So for us, we're really guided by 5 key values: integrity, excellence, courage, together, and for better. And so those things really guide our interactions with each other, our clients, our capital markets, our regulators. And it's really something that all of us from top level down to the lowest level in the enterprise really embrace. And to get leadership to activate, you have to have them participate. They really have to be driving the agenda for these change initiatives, whether it's mental health, it's a racial equity thing, it's a D&I thing, whatever it may be. Getting the activation at the leadership level is so critical. So what I mean by that specifically is leadership have to not just talk the talk, but they actually have to do the talk. They have to walk that walk as well, and they have to lead by example. And so we're finding that our leaders are wholly bought into this concept of mental health being a priority. In fact, we've got a whole framework that we think about when we think about the health, the holistic health of our people. That framework includes financial, social, emotional, and mental, and physical as well. So if you think about the complete health of our employee population around those 4 dimensions, our leadership have been putting programs in place across each of them to create a holistic health, healthy workforce, if you will. So those are some of the things that we're doing.
How about you, Nick? How as a small business have you been able to engage with senior management, with leaders, and talk to them about how important mental health is? Get their buy-in.
Integral to start from the top down. This is something I'm extremely passionate about, both for safety and health and a holistic impact of both of those. If you do not have buy-in from the top down, then you don't really have a budget, right? And if you don't have a budget, you don't have any teeth to that health and safety program. So it's got to be there. One of the ways that you start, just like Sean said, it's inside all of our core values. One of our core values is health and safety. It's in our mission statement. It's the way we choose to do business. If it's not enough for your owner or for somebody at your company making these decisions to do it because it's the right thing to do, then make it a black and red or a balance sheet issue for them. Help them understand the kind of work comp rates that are impacted with accidents on site or even car accidents caused by addiction, mental health, anxiety, depression, all the things that can impact the way a person performs on a very dangerous job site. Those kinds of things need to be top of mind for leadership so that they understand that not only is this the way that we treat our employees the right way, you look at the costs associated with retraining, you look at the costs associated with rehiring, terminations, fighting unlawful termination lawsuits, et cetera, right? And you start to realize how many costs there really are impacted by not taking care of your people the right way. And then to the other point that the question person asked me in the question, let's see, how do you do it when it feels taboo or not as important as doing the work that they provide? I'll tell you what, it shouldn't feel taboo. And the way you make it not taboo is you get your leaders out there starting to talk about their own mental health and wellness. I talk about at our all hands meetings, the things that I'm doing personally. So does our HR manager. Everyone's encouraged to have those discussions. Our owner even chimes in from time to time about mental health and wellness, his past history with addiction and addiction counseling. So we're open, we're honest, we normalize it, we make it real, and we make it part of what we do. And I would challenge your owners and your leadership that they need to do the same thing.
Thanks so much,
David,
Nick.
if
Yes,
I might
go ahead,
just
absolutely
add to that, Nick,
Yep.
I think that's been very much affirmed in the work that I've done around DE&I with companies, especially with including and normalizing mental health. Like you said, I've talked to so many different employees where they've said the thing that helped them actually pursue services was colleagues and leadership actually naming it for themselves and saying, not in a way that feels like an overshare, you know what I mean? Where you're like, okay, now I feel really close to you and I really want to, not like that. But just saying, hey, when I went to my counselor, the things that I learned during therapy are these types of things, and having it be just a regular conversation, like you took your son to the pediatrician. And people have said that actually made it feel like it was okay for me, like I wasn't going to be punished or seen as weaker or limited in some capacity. So I just wanted to affirm that I've heard that time and time again from people that really is effective.
I appreciate that perspective also from all of you. I agree. I think had I thought about my introduction or the sign behind me in the beginning, I'd probably claim anxiety as my superpower. I know that it can be difficult to be vulnerable and to be transparent about any sort of health issue. For some reason, we do a better job talking about I broke my arm or I'm sick today, and not as great a job talking about, I have anxiety or I'm depressed. But really, we're hoping to get to a place where we raise enough awareness that people feel comfortable speaking up about these things. So I have another question, and I think probably this is going to be relevant for all three of you. And I think, Nick, I'll start with you, perhaps because we've had a few conversations about this recently, but this term languishing has come up recently in literature of how we all are feeling. Everybody has a case of the blahs for the past year. And I'm just curious your thoughts as people start returning to the office. How can a small business or large, or Andrew, I'll ask you as well, how can we better manage this sort of languishing blah feeling from the past year that people are having? Do you have any thoughts about what you're going to put in place to get people sort of their mojo back, if you will?
Yeah, I challenged our leadership team to have clear, concise direction on how we're going to be expected to proceed. The worst thing right now could be for leadership not to step up and say, here's what we expect, because things are changing, they're dynamic, they're very different. Every company is different from one another, and each district and county is different in what they're requiring, et cetera, right? So nobody really knows exactly what we're supposed to do or what's going to be expected of us. So we have to internally decide what we're going to expect and let everybody know that, here's clear-cut expectations for your return to work program or your dynamic schedule or the things that you have going on with your family. Here's what we expect, and here's how we can move forward together as a team. And then listening after you let those expectations be known, listening to challenges, things that might be in the way, and then working together with your employees through one-on-one coaching and figuring out how you come up with a good plan.
Thanks. Andrea, I think I'll go to you next. Clearly, languishing and dealing with stress repeatedly is something that the BIPOC community has had to deal with for 12 generations plus now. So I'm just curious, your thoughts about people's feeling of languishing in this moment, and what the return to work might feel like.
Might look like, yeah. I think that from our earlier question, part of what also came to mind to me is the importance of labeling and language, and how central that can be to shift culture and normalization of mental health issues. I think languishing can be a new term that can accurately describe what someone is feeling, but there could be a lot of others. There could be some obsession compulsion with how clean is clean, right? And kind of a germ aversion. There could be anxiety, depression, and something I'd said at another presentation is that, it may not be that you yourself are struggling with anxiety or depression. You might just be paying attention because your nervous system has had an onslaught of unpredictable traumatic things for over a year. Add to that race-related stress and trauma, right? So that may just mean that you're experiencing something that means that you're awake and alive. So not to shame oneself for that, I think is very important. And to understand the long haul, if we want to use the COVID term, right, for how that gets reestablished. I think returning to work when we live in a capitalist society like we do can often be synonymous with returning to previous life. Like we didn't just have the year that we had or year and a half that we had. So I think it can be important for employers to consider the way that we were forced to embrace humanity and reality, right? Where you've got kids and dogs and leaf blowers running around, and knowing that these people are not just machines, but they're human beings with real lives, not to lose that perspective. They're still human beings with lots of real lives and possibly race-related stress and trauma and children to manage and all these other things on their plate. So continuing to know that and understand that now what we're dealing with is a lot of anniversaries, right? If you've ever lost someone or experienced a grief pattern, the firsts are tough sometimes. And so we're entering into that as we're entering into the return to work too. So holding that, I think, gracefully and considerately and intentionally, I think is very helpful for people so that they don't feel like they have to have themselves look like the 2019 version of themselves when they come back to work, if that makes sense.
That does make sense, Andrea. And I have really had to shift my own verbiage of how I experience anxiety from a struggle to just who I am. And that's why I've really been trying to embrace it as my superpower. I've yet to be called on a meeting to describe my superpower. I'm just waiting for the time where somebody can say depression or managing depression is my superpower. And, getting to that point will be I think a real milestone. Sean, I want to ask you too about this idea of return to work, people languishing over the last year. What is KPMG? What are your team's thoughts about how to address that as we come back to this new normal or whatever it is we're in?
Yeah, I think, much like Nick, and whether you're a small enterprise or a large enterprise, you have some of the same challenges. Our professional base go to an office typically pre-pandemic, go to an office typically every day, whether it's ours or it's our clients. That obviously shifted quite abruptly, very, very fast, and it still continues today. So our focus has really been on how do we reintroduce our workforce in a safe manner, both at our client or at our own offices. We've begun to do that in pilot programs around the country with different offices, depending on local conditions, getting people back introduced to that. During the pandemic, we spent a lot of time reformatting office space to accommodate social distancing, providing certain protocol or putting certain protocols in place, even crazy ones like when you come in, you enter on the right, you stay to the right. There's mappings for where to walk. It's kind of a weird concept, but I guess it's what we've got to live with these days. So that's one thing. The other thing is we're really trying to be sensitive to, as Dr. Holman pointed out, everyone's human. Everyone's got a bunch of stuff they're juggling in their life. And everyone's different. Everyone's experience in this process is very different and unique to them. So we're trying to pay attention to that and understand that we have 220,000 unique experiences that go on day in and day out. and how do we accommodate that? So the best way for us to accommodate that is to be flexible. And flexibility comes in the form of, how we're thinking about it is a hybrid workforce. So some people will come back, choose to come back and be able to come back into the office on, quote, a full-time basis like they did before. Others will be in a couple of days a week. Others may never show back up in the office and choose to work remotely for periods of time, while whatever stage in life they're in completes and they're able to get back to the office or something else. So those are a couple of things we're doing. And then to address the languish concept or the isolation, I saw one of the text chats, this isolation notion. We're doing a couple of things to help people kind of detoxify from their technology that they're, that's ever present with them every day when they're on these Zoom calls, team calls, whatever, back to back to back. It gets really fatiguing. And so we've implemented things like this notion of what we call Heads Down Wednesday, which every afternoon we basically say we block firm-wide, we block people's calendars for 2.5 hours and we say, this is your quiet space. No meetings, no phone calls, no nothing. Think about what you need to do next. Think about how get your work done essentially that you need to get done in a quiet manner that's unique to you. We implement, and we started doing this long before COVID. We implemented what we call Jumpstart Fridays. So we get people out of the office Friday afternoon, wherever their local market is, so they can get onto their weekend earlier, and that's paid time. And then we take a couple of weeks off during the winter break where it's paid time off. We say between Christmas and New Year's, don't work, detach and stay disconnected. And then we've also recently done that in the last couple of years with a summer shutdown, which we do as well. So those are some of the things that we're doing to help people not be so ingrained with their technology and with their day-to-day work.
Thanks, Sean. We can never get to all of the questions that come up. And I do want to address one more question, but people are asking about resources, things like what does the definition of mental health even mean? So we're going to explain to you in just a few moments a tool that we have available for you at your workplace and to implement with your leadership that includes links and references to specific mental health trainings. You'll also get a mention, the link to our new workplace mental health module in the follow-up. But this idea of protecting time, I think, is really important. It came up as we were talking with our panelists before all of you joined the webinar. We've heard of things like Zero Entry Mondays. Shout out to Ground Floor Media and Center Table that does no official meetings until noon on Mondays to give people sort of the Monday morning to get ramp back up into work. Taylor was talking about Flex Fridays and what that could look like. Sean gave an example as well, where after noon on Fridays, also there's no meeting scheduled, unless you absolutely want to or have to, and that's giving you sort of a time to prepare for the weekend, maybe wrap up things that were going on during the week. We're also talking about things on Wednesdays, and I know there are shift work and there's other types of work like Nick's industry where those sort of things are not possible, or they're only possible in an administrative office. But what we really encourage people to do is look holistically at the schedules that people have and figure out where there's opportunities to give them a break, to de-stress, to take some time. The last thing I want to ask, and I don't know if this has come up, maybe I'll start with you again, Nick, is mental health can be private. It can be a really private matter for people. And I know again from some of our conversations that you've had some real challenges with employees that actually feel comfortable disclosing to you the type of challenges they have. But how do you balance this? We don't have HR professionals necessarily on this panel, which I think some of this may be HR related, but how do you balance the privacy concerns around mental health with actually getting people the support and help that they need?
I'd say two things. One, make sure that there are multiple resources internally for people to reach out to. Each employee should never have only one contact if they need something. That prevents the retaliation from a manager they may not get along with, et cetera, right? There needs to be multiple people at your company that people can feel comfortable reaching out to. And then past that, if they don't feel comfortable reaching out, say it's something that's very personal, an addiction that they don't want to admit to, they're afraid of retaliation for, having some sort of weakness, saying that, I'm depressed about this and I don't feel like working. Well, that's the last thing you want to be able to admit to your supervisor, right? So putting those resources directly in front of your people, meaning mental health resources that your provider or your carrier can provide, right? Or having people come in and discuss what they can do for your people, actual providers coming in, talking on your all hands meetings or your company meetings that you have via Zoom or whatever it is. using that venue to highlight your focus on mental health by having a provider there to discuss, here's what I can do. You can reach out to me directly. You don't even have to go to a supervisor. Those are two ways that you can definitely, get that privacy issue out of the way.
Thanks. Nick, any thoughts on privacy concerns related to mental health disclosures? Has KPMG done some work or thought about this?
Yeah, we do, and it's probably outside my domain from a privacy perspective. But I can tell you one thing we do. We have a self-identification process. However you want to identify across any range of differences, if you will. And so that's totally anonymous. People can self-select. We're able to get a snapshot of what the profile of our community looks like. And mental health is certainly one of those aspects. We also have an employee assistance process in line, which is anonymized. It's not connected to supervisors, as Nick was pointing out, very valid concern. And people are free to use that as much as they need to. They can get access to, the live therapy sessions, virtual or text-based therapy sessions as much, need as they want. So we do what we can to keep that, very sensitive topic for those who want to keep it close. We allow them to keep it close. The other thing we're doing is, this goes back to the first question you asked in the session of getting leadership engagement. One of the things we've done here in the Denver market, and we're doing it in other places too, is we've engaged outside clinicians to come in and host like brown bag lunches with us, where a leader like myself or other of my partner colleagues will come together and we'll kind of tell our own stories of our challenges, on this topic. And then we'll have clinicians that'll come in and present on topics to our people around, happiness training, for example. And I got to give a shout out to the Johnson Depression Center, who helps as our partner in doing that here in Denver. But we get wide adoption. We get people pre-COVID, we'd have 150, 200 of our professionals show up to this event over the lunch hour and listen. That's the biggest self-identification right there. You're physically showing up in the room. So we found that people those types of events really help destigmatize and get people more comfortable about having authentic conversations about, their situation.
Thanks, Sean. Andrea, do you have a brief comment on that too?
Yeah, I agree with everything Nick and Sean said. I think those are really great points to get people to utilize services. I think I know that when I was doing therapy full time, there's a lot of mistrust that can happen, medical mistrust that can happen, particularly in Black and Brown communities. And so part of what I think helps break down that hesitancy and that guardedness is to talk about the logistics of it. To literally talk about the limits of confidentiality, what will happen in therapy. I think clinicians coming to present is great. People from EAP services or whatever it is that the mental health benefits are through, to say, listen, these are the things that they can't say, they can't tell these people at your job these things unless this happens, and they're really going to tell another professional, so breaking it down very specifically, because I've had people ask me like, okay, but for real, is my supervisor going to know, are you really just going to tell them on the sly? If it's really juicy, are you going to tell them? So they have this mistrust, of this vulnerable thing that I'm doing. How is that going to be, how's that information going to be kept and held as such, as intimate, vulnerable information? And the people working with them are legally bound to do so. So I think actually emphasizing that and kind of highlighting that and the logistics of how you sign up for it, how you actually use the benefits, I think that's helpful, just so that people can know and feel a little bit more empowered to say, hey, if somebody does find out, that's not great, so I can actually have some kind of complaint against that. So I think that gives them a little bit more safety to it as well.
Thanks so much, Andrea, and thank you to all of our panelists. The Q&A session is always so informative for our network to hear how people are really putting this in practice. I am going to do my best in 60 seconds to let you all know about this terrific resource that we're launching today in honor of this webinar and in May being Mental Health Awareness Month. So we've launched a specific module on workplace mental health that includes a 16-question survey with some drop-down menus to assess your organization's commitment to workplace mental health. You get customized advising along with the survey through our HealthLinks platform, as well as some free resources and a toolkit that's available to you. You will find out more information about this module in the follow-up email, and we'll be sending press releases about it, as well as social media. You'll hear a lot from us today and in the coming weeks about the workplace mental health module. This is, such an important topic for all of us to better understand in the workplace. The survey itself, I'll just mention, has 4 sections that we're asking questions on. What does your culture look like? What sort of benefits do you offer? What sort of education and training is available to your team members across the organization, as well as how equitable and accessible are the benefits you offer. We do have another webinar coming up, and as you fill out the survey, as you leave today's meeting, you'll get a link to register for it. It is on becoming an anti-racist workplace, our individual and collective responsibilities. This is on Wednesday, June 16th at 11 a.m. We'll be mentioning and talking about Juneteenth on June 19th and how some organizations are taking this week of middle of June, or the experience of Juneteenth in general, to become more of an anti-racist workplace. I think this is work that we're doing, for the long term. And so we encourage you to register for this upcoming webinar in the middle of June. Finally, just thank you again to our panelists, to our presenters, to all of you for joining us today. Take a moment to complete the survey as you log off from today's webinar. You'll get a link to register for, also, in our follow-up, we'll tell you about our next webinar, as well as all of these resources available to you. So thanks again, everyone, for participating and for joining us today. Really appreciate this important conversation.